What is considered when choosing a treatment? Are there test results that can impact the options?
So there are. So for the most part, we'll take a couple things into consideration. So there's no standard of care for follicular lymphoma. So there are a couple different options that can be utilized in the upfront setting for the untreated patient. So comorbidities play a part in what sort of treatment we choose. Patients' age and fitness will play a part. If there's any heart disease, that'll play a part into the situation as well. And also, as I said, stage will play a part in sort of what our treatment goals are. If our treatment goal for a really unfit patient who we don't think can tolerate chemotherapy is just a symptom control and they don't have a lot of disease, we can sometimes treat them with just a monoclonal antibody we call rituximab as a single agent. If the patient has a lot of disease and they are a fit patient, we will tend to combine rituximab with several different chemotherapy regimens because rituximab plus chemotherapy works better than chemotherapy, and also rituximab alone, especially depending on the amount of disease that we're trying to treat. And again, as mentioned before, if it's a localized patient, it'll normally be radiation plus or minus rituximab in that situation. But because of some of the side effects of the drugs we use, and obviously now we're in a pandemic, a lot of those will take sort of some of the consideration to what we use. Some of the drugs that we use are even more sort of immunosuppressive than others. And obviously being in a pandemic, we have to take that in consideration because, again, we're not treating to cure. Some of the drugs can cause heart damage. Some of the drugs can damage nerves. Some of the drugs include steroids, which may be prohibitive in some patients. So all that sometimes has to be taken into consideration when we choose a regimen.
Yeah. It sounds like there are a lot of factors coming into play here.
Yeah, I mean, normally without a pandemic, there's a lot of factors, and the pandemic just makes things a little bit harder just because, again, our patients are at risk based on some of the treatments we choose.
Yeah, it's pretty challenging right now. Does treatment typically start right away?
So that really depends on stage and also whether we meet certain sort of criteria to treat. So we don't have to treat right away. So if a patient has a disease and the disease is not in an area where we think it's curative, for the most part, we can enter what we call a watch and wait, meaning we will observe a patient very closely and defer treatment until the patient develops symptoms or other indications that warrant treatment. We do know that there is no impact on longevity by sort of partaking in this approach. So you won't live any longer or you won't live any shorter if we watch and wait versus initiating therapy right away. It just saves you from having some of the toxicities from treatment without any really major benefit. So remember, the goal for most patients with follicular lymphoma is to alleviate symptoms or problems. If you don't have a symptom or problem, me giving you treatment is not going to make you feel any better. Actually, it'll probably make you feel a bit worse to get you back to where you were when you started.